joining us from Arkansas, I believe. Professor Kevin Fitzpatrick, you are with us, I believe, in body and mind. I see you. I think I hear you as well. And you're going to be telling us more about fear and uncertainty in the midst of the COVID-19 pandemic. And the consequences this has had on the U.S. adult population. I'm going to leave it at that and turn it over to you.
Well, thank you. Thank you for having me. And let me just get the screen up, and I think we're good. Yeah, thanks for inviting. A little early here on my side of the world, but I know that you guys have been gone, what for me is all night. But excited to share a little bit with you in the short time that we have today. I wanted to give you some broad overview. I don't have to spend a lot of time, I know, talking about today how so many people have been impacted by this virus, not only here in the United States, but as we've heard from literally studies around the world these last few days. We know that infections and hospitalizations and deaths continue to rise here in the United States. And we I think are a unique world circumstance. And I think that our data, when it was collected, is going to provide a slightly different perspective than maybe what we would have right now. And I'll talk a little bit about that. But again, the broader background of fear that I want to talk about and uncertainty, keeping in mind that we've had these ongoing conversations, not only here in the US, but around the world, about just general fear, about risk, people battling over whether they should wear a mask or not, the physical distancing, do I go to work, do I go to school? All of these, I think, have helped to create a new level of anxiety, a new level of uncertainty and depression, and as you'll hear, even suicidality among U.S. adults in our study. In the short time that I have, I want to just give you some basic background, a glimpse of some of the empirical work that we have just started. Again, we are interested in part in terms of how fear is diffused across the country, and that diffusion has clear implications for pocket populations and their mental health. And I'll then end talking about some risks and consequences that we've just started to look at and that we've already found, and I'll reference some of the published work that we have related to that. Since the first US case that was confirmed in January, the novel coronavirus pandemic is and will continue to create, as we know, both individual and systemic challenges. And we also know, and we've heard over the last few days, that this is going to require some pretty significant mental health intervention, not only in the weeks ahead, but the months and potentially the years ahead as well. We've heard that there is this burgeoning work that is coming out of China, Europe, Canada, and of course the US. And it's clear that we need to be bracing for, if we are already not doing that, for a significant mental health event. Fear and uncertainty continue to spread not only here, but other places around the world. And I believe that it's partly fueled by this media conglomerate that is very hungry for the next big story. And couple that with a social media conglomerate that has consumed our society. And I think that every anecdotal story that we could map on COVID-19 doesn't always sit up well with the actual empirical fact. So if you take all of that, coupled with all of the other collective and social behavior that is ongoing around the world, no wonder that residents, certainly here and other places, are worried and they feel threatened, and rightfully so. Fear is something that is deeply rooted in the history of our country, as is in other countries. There is a substantial empirical literature that's documented the circumstances of fear in the context of past epidemics and pandemics, but also other public health and other kinds of disasters that have impacted social systems around the world. The challenge, I think, for us is to try and document a fear that for many people, I believe, they have trouble articulating. It's not like the fear of heights. It's not like the fear of snakes or spiders. It's certainly more amorphous and oftentimes very difficult for people to express, particularly when they have this feeling of invincibility or maybe even limited empathy for others that may be a greater risk than they are. And I think that's a complexity that we can't necessarily tease out, but one that I think is in part background for what we're going to talk about. But despite all of that, the polls are clear, right? National Public Radio in the United States, the Kaiser Family Foundation, Gallup, the National Opinion folks, Angus Reid Institute in Canada, they're all pointing to the same central finding, and that is worry and fear is associated with an elevated level of COVID-19. And I believe that there's clearly, and I think that we have some data that may be implicating this, but clearly a linear relationship that as the number of cases have increased in this country, the level of fear has as well. And again, I mean, one of the things that I do want to talk about, and some other folks are beginning to talk about this, is that fear and worry and threat and concern are not evenly distributed geographically across the United States. They are also not distributed evenly across social groups and social categories. Fear tends to be clustered among more vulnerable and typically also more vulnerable that are living in high-risk neighborhoods throughout the US. So let me quickly just run through some of the background of the study. The National Science Foundation is the funder of this work, and our data come from a nationally representative sample that was post-weighted to reflect the US adult population in the US. As you can see, over 10,000 respondents. Qualtrics, large firm, data gathering firm, collects the data for us in around the third week of March, and takes about a week to do that. We post-weight it, clean it, and we're ready to analyze by the beginning of April. A rather quick timeline, maybe the quickest timeline we've ever been on in terms of doing the kind of work that we are doing. This online platform gave us about a 15 to 20 minute window. We didn't feel like we really wanted to spend more time pushing folks to answer questions beyond that. And I'm going to talk about a little portion of that data today. And some of the brief background, and I apologize for that being a little bit small. You have to get up on the screen to read it, but just a few highlights. The first group are some of the subjective assessments regarding fear or related emotion. And then in the middle, we have some demographic background, and then some of the mental health characteristics that we looked at. And those are mostly familiar with, I'm sure, all of us. And I'll talk a little bit about each one of those. But this post-weighted sample just provides a snapshot of the US. Our sample tends to be a little bit older, a little bit more educated, a little bit more urban than what we know to be generally the character of the US population. But I don't think that that's uncharacteristic, I think, of large online samples. I think that is typically reflected in the sample that we have here. So let's just briefly talk about some of these measures. Again, this first group is really the subjective assessments that we were interested in. And we went back and forth quite a bit in trying to make a decision about how are we going to measure this. Unfortunately, in the first week of March, there was no COVID-19 fear scale like there is now. and all of these other scales that have emerged, we were really struggling with a literature that didn't give us a whole lot of guidance, but we settled on something that we felt that folks would be responsive to because they've been responsive to it in other ways. For example, when we are in great pain and we go to our doctor, one of the first things that they ask is typically on a scale of 0 to 10, tell us how much pain do you have? People are typically responsive to that. And we thought, maybe this would be a useful way just to assess, again, subjectively, in the same way, how people sense their fear of the coronavirus. So why not just ask them on a scale of 0 to 10, how fearful are you? And you can see, if you go back and look at the average, almost 7 was the average, but also more than 45% of the sample scored 8 or above. And it seems, at least on the surface, and I think this bears out as we look a little bit closer to the data, that this is a pretty fearful sample, even at a time when the curve was only beginning its upward trajectory. And again, keep in mind that we are early in data collection relative to where we are right now. And then you could see that we also asked, and I just picked out a couple of the Likert items here. We have a much more comprehensive set of scales. This one just happened to ask how people were personally worried about infection and then personally threatened by the virus. And we just picked out the extreme categories. But again, a rather large percentage of this group noting that they were either extremely worried or felt a high degree of threat. And then, we also looked at and were interested in, and again, just a sampling of the kinds of questions that we were asking about individual actions and what role they might play in developing fear, and were there significant relationships between them, and were people mitigating and engaging in behavior that might help that or again exacerbate that fear. And here you could see some typical behaviors that we were measuring, and then a group of maybe extreme or slightly more extreme behaviors regarding hoarding and stockpiling. And then we were also interested in travel, and frankly, while we think that's a pretty interesting reflection of what's going on, we really haven't had a chance to unpack that yet. But you can see that 3/4 of our sample have somehow contained what it is that they're doing and where they're doing it. And then the last group of measures that are relevant to what we're talking about here today are just the mental health consequences, a few of them, and their relationship with fear. And you can see that there are a couple that have rather high correlations. Of course, there's 10,000. We recognize it doesn't take much to be significant here, but in terms of the size of those correlations, there certainly are a couple. And anxiety and depression are two that we happen to focus on quite a bit in some of our later work that I'll just briefly mention. So that just gives you a quick background on what we are trying to measure. I want to just spend a little bit of time talking about this whole diffusion idea, and I apologize in advance that there may be everybody who's sitting in on this talk right now. Really, when they look at that map, it may not make a whole lot of sense, and I don't want to be regionally American centric, but I do want to try and just show you a little bit about the diffusion and how different it is across the region. And I'll provide some background for you. What you're looking at are the 4 census regions of the United States. The red being the Northeast, the green, the South, the yellow is the Midwest, and the blue are the West. What's really interesting here is that there is geospatial variation in fear. And you're going to see as we move along with some of the other figures that there's some difference. And I think we have some ideas to why there are some differences and what those differences mean. Here you can see to the left of the map just the distribution of the fear variable in terms of the percentage of respondents that were scoring in those areas. And I will note that there are significant differences across in terms of fear, significant differences across these four regions. So, you know, and again, I'm trying to squeeze a big map onto a little screen, and I know it's just so compressed. But what we're looking at here is the distribution of fear across all of the counties in the US. There are some 3,200 counties in the United States. County ended up being the chosen point, the geographic point that we used. We asked respondents about their zip code, which is their postal code. And then we also had a latitude and longitude, and we're able to match those up for about 1,500 of the counties and about 8,000 of our 10,000 plus respondents, because many people are filling it out on a phone somewhere else, and so we know that there are only certain numbers, and so this is a little bit smaller number than our 10,000 plus, but you can see there's some distribution. It's not equal, and there are pockets of concentration, and green is the lesser fear and red is the greater fear. And you can see that again, there are some important areas that are concentrated. I'll talk a little bit about why those emerge as concentrated areas of fear. Another level to this is it's the same map, only now what we did was look at the concentration of cases, confirmed cases during that particular period of our data collection. Very difficult to see, but in a blown up map, when the circles are evident, it's really quite obvious that there is a clear connection between the level of fear and the number of confirmed cases in those counties. Again, I think we have some more detail on this forthcoming, but this gives you some broad overview as to what we believe are really an important set of relationships. And again, I don't want to overburden you with digging too deep, but having presented this to a US audience, this slide really just gives us a little bit more information about what some of those pockets were. And you can see that in some states, there was really high average concentration, what I would call, you know, extremely fearful. And they tend to be, again, concentrated in some states that emerge in the Northeast and the South, and of course, spread out of a few other places as well. But it gives you an idea of sort of the ongoing top 10 as well. And finally, let me just shift and wrap up by talking a little bit about some individual responses that tap into this underlying fear. You can see that what we have here just are some percentages that give us some idea about what folks are particularly fearful about or concerned about. And you can see that the lighter the bar, the more extreme their reactions might be. And you can see that worried about job and worried about bills are certainly very important here. And I think that captures, and we've heard others talk about it, that captures a great deal of the uncertainty that we're recording. Also, as I mentioned earlier, fear is not uniformly distributed across different racial and ethnic groups. It is concentrated, and you can see that there are some differences between the white majority and other racial and ethnic groups. And again, I want you to focus on the lighter bar where you can see that there's some differences in terms of how people see a threat relative to how people see worry and fear. And we're just beginning to really sort of look at some of those issues. The last thing I just want to mention is that we've done a number of studies now, and we come away with some critical findings. First off, as you can see, and as I've mentioned before, there is a vulnerability here. A vulnerability to fear, a vulnerability to the consequences of mental health. Our work seems to show that Hispanics, low-income, unemployed families with children, even younger respondents, which is sort of interesting, and I know you've made reference to that before, seem to be more fearful. We also know that there's some pretty significant correlation with mental health symptomatology, as I've mentioned, and some other social and behavioral responses. And we also, as you've seen in the maps, but we'll continue to do this in terms of the work that is forthcoming, talk a little bit about how fear is related to both food insecurity, and then is also related to the high concentration of confirmed cases, as well as mortality and morbidity in these locations as well. You know, this reflects some of the work that we managed to get out quickly, and I certainly would encourage folks to go take a look, and would be more than happy to talk in depth about this. We have other papers that are going to be coming out soon on food insecurity as one of them. I think that's a particularly important issue, I think, for us here in the U.S., but around the world. You know, we were a food insecure country before this pandemic, and all that it did was just reveal what kind of circumstance we were in right now. So I think that's also an important part of what we're trying to capture. But thank you again for the opportunity to quickly share in this morning about some of the work that we're doing, and I'd be happy to answer any questions if we've got any time left.
Well, no, thank you so much to you, Kevin, for that wonderful talk. I have lots of questions myself, but the chat went wild, which is obviously an indication of just how relevant and important your work is. Some people suggested that you could do more with your zip code data, but perhaps that's something you're doing. Jayant, our last speaker, said, you know, for example, zip code data on political affiliation could be used.
We actually do have a paper right now that looks at political affiliation and fear, and as much of the general media has reflected on this, we have found that Democrats are probably 2 to 3 times more fearful than Republicans and independents. And that is a really important driver, predictor of fear in a paper that we have currently.
For the spread of the actual disease?
I'm sorry?
Does that control for the actual spread of the disease? Because obviously you have this confound that the hotspots are annoyingly as a data scientist, you know, also where you have a fairly large divide between the parties. So are you controlling for the infection rate?
We have started to look at multi-level models, and I will tell you, just because I knew that I'd get a question, we ran some preliminarily and have found that there are several individual factors that I've talked about here today. Political affiliation is one of them that holds up under the additional drag of structural factors like the Gini index and measures of poverty and the confirmed cases and the death rate and several others. You know, I mean, that's a really interesting story in and of itself in terms of what manages to survive the onslaught of structural factors, because as you I'm sure know, sometimes can vary the individual effect, but consistently death rates, more so than confirmed cases, appear to be the structural driver there in terms of place, but political affiliation, gender, ethnicity, and I
age. You
believe,
mentioned that the younger
yes,
population as
and I
well.
believe age all managed to hold up even after controlling for those structural effects.
Goodness, I mean, that was sort of the same question asked by Sam Warren. So people are obviously very interested in those kinds of questions. We have another question from Runjing Liu, who'll be talking in an hour's time, I think. And he says, we know that the COVID-19 situation has changed dramatically since you collected this data. So he wonders whether there'll be a follow-up. It sounds like you're pretty busy with the data you've collected, but
we want to do a follow-up. I would be ecstatic if someone came along and threw more money at us to do a follow-up. It's an expensive undertaking to actually do that in the time frame that we wanted it done. But we are actually looking at that. We would love to do that before school starts, because I think there are some really important questions that we want to revisit. There are a lot of things, of course, as we all know, that we ask, and they didn't turn out to be very interesting, and we could let them go by when we brought in some additional questions. So, yes, the answer is
watch the space.
yes, because it was such a unique time when we did it. I think that it would be very interesting to come back now, several months later, and revisit it.
As a sort of add on to that, is your data open access? We have a question in the chat.
Not as of right now. It is not. Under NSF sort of not regulation, but we're holding on to it for a little while. But I certainly would love for people to contact me, and if they want to look at data, or they want to pair their data up with our data and ask similar questions, or that they've asked similar questions and want to see how things are connecting, I would love for that. We're absolutely, we're collaborating with some folks in Canada. We would love to be able to do that as well with anyone who's interested in. So I encourage you.
To my mind, probably even better than open access is open arms. And then sort of just as a final, more psychological question that I have for you is, you mentioned the travel data, and all of a sudden it occurs to me, we're talking about fear, we're talking about fight or flight. No, but honestly, it hadn't occurred to me, but it was the first impulse I had, is get my family somewhere safe. And it was a very strange and incredibly overwhelming experience. And we luckily had somewhere where we could go and have a lot of space, and we're certain to be more secure. I wonder if that's why you included that, and if you have any hypotheses about that.
It is partly why we did. We did, in fact, actually think that there would be a little bit more domestic movement here. So, people going to their families, and where a lot of the international travel that I think is originating from the U.S. is very much business focused, and we knew that as everyone was drawing back, that we would see less of that. It was really interesting, and I don't recall the numbers, but some of the recreational travel was still surprisingly available to people, and they were okay with that. And while it wasn't some gigantic number, there was a relatively good size percentage of people that said that, yeah, they in the next month or so, they figure that they'll do some traveling. Now, I bet if we would have went back to them the following month, they would have said, oh no, I'm not going to travel. But again, I think that's part of capturing this early period of time that really the early part of March, things were not where they are right now in terms of people's perspective, which
again, to highlight why you need more funding, and it's
exactly.
to do your job. Without, unfortunately, that's all the time we have left. But I just want to thank you again, Kevin, for your data, for your time, for your generosity in terms of welcoming potential follow-up collaborations. And I'm going to turn the chairing to my colleague Baha, who is going to introduce our next speaker.